So then I was thinking, what are my olden days when I was doing my post-graduation 15 years back? So what all the difficulties I used to face when my seniors used to come and say, go and take an ABG sampling. So I was not aware how much to take, what amount of heparin to use. These are the common doubts we have in our mind as soon as we go inside. You all must be having it, right? So I have tried to condense my lecture in such a way that you will be able to have a practical understanding what amount of heparin should be using, what amount of syringe you should be using, and what all the changes it is going to cause to your parameters, what you're going to measure in the ABG. Everything I'm going to talk on the 6. So my objective on this today's topic will be, I'll be talking something with regards to the pre-procedure guidelines, how to do arterial sampling, what is the, in case if you don't get a sampling techniques, what are the other alternatives available, and what are the pre-analytical errors, and what are the guidelines as far as the meta-analysis, what is in favor of sampling techniques. So once you see a patient, you go, most of the time when you go and see a patient will be critically ill, so you think of doing an arterial sampling. You think of ordering a test for the patient. So you say, okay, get an ABG done. So all these four parameters has to be taken into consideration. First is the patient identification, how you are going to do the sampling, how you are going to do the transport of the sampling, and how you are going to do the sample handling. These are the 4 major criteria with regards to your blood gas analysis. So once you know this thing, patient identification immediately come. Whether I'm doing the ABG on a right patient, that's thing comes to your mind. So okay, I have identified, okay, I'm going to do this on the patient. Once, how we are going to do the sampling? Is the patient is adequately prepared? Is he able to tolerate the pain which I'm going to go through the needle? Second thing, what amount of additive I'm going to use? What amount of heparin, whether it's 5,000 international units or it's going to use 1,000 units, this will be a doubt in your mind. What type of container? It should be a 2 ml syringe or 3 ml syringe, or it's a 1 ml syringe. Okay, I have done the sampling. How we are going to do the transport? Is the sample delivered in time to the lab? What is the adequate timing? Whether it's before less than 30 minutes or after 30 minutes. And is the transport temperature okay? Most of them you will be transporting with the ice cubes. So whether you are going to do it with ice cubes or ice water or cold saline, what I'm going to use? These are doubts which we'll have. Once this transport is done, sample handling is mixed, whether you mix the sample properly with the additive agent. Or the type of analysis, the lab person says the clot is sampled. Sample is clotted and there is a hemolysis. So a lot of things goes in our mind. So all these doubts I'm going to carry it one by one. So blood gas testing is a unique way in many ways. First thing is patient condition. Most of the patients will be unstable. So you may be doing in a very hurry manner or you may be doing it in leisure manner. So you may be doing a regular